Hello, my name is Janice Linton. I'm the librarian who's going to be training you today for the Systematic Review Workshop Series. I'm going to be teaching about advanced searching for systematic and scoping reviews. And this is part 3 of the Systematic Review series. And I'm co-teaching with Maylin Lay. And yeah, we're just about to get started. This session is about 90 minutes long. And I first just want to do a traditional territories acknowledgement. As I mentioned, my name is Janice Linton. She and her are my pronouns. I'm grateful to live on the original lands of the Anishinaabe, the Inanawak, Anishinawak, Dakota Oyedi, and Denisoline, and on the national homeland of the Red River Métis. I give thanks to the ancestors who took care of these lands for generations, long before I ever lived here. I am descended from Scottish and English 19th century settlers. My father taught me to honor the treaties and to respect the elders. As a member of the University of Manitoba community, I can say that we all respect the treaties that were made on these territories, that we acknowledge the harms and the mistakes of both the past and the present, and that we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. As a non-Indigenous friend to First Nations, Métis, and Inuit people, I am truly devoted to being part of the solution rather than part of the problem when it comes to taking action or speaking out to support equity, health, and wellness for Indigenous people. And those are things that I've learned both professionally and personally in my time here with the University of Manitoba and living on these traditional territories. And yeah, I'm just going to say thank you for sharing that territorial acknowledgement with me. So as I mentioned, this is part of a 5-part series. I'm just going to turn off my video so that you can focus on the slides. And this is the advanced searching for systematic and scoping reviews. There's a couple more sessions in this series that will be the next one, part 4, is a second part on searching that I'll be teaching as well next Wednesday. And part 5 is in a couple of weeks, and Maylin will be teaching you that. You can register for upcoming sessions by scanning the QR code, and that'll take you straight to the workshop registration page if you need to register for those sessions. And just a few housekeeping details. Remember to mute your microphone, keep your video off for recording, and you can ask questions via chat. Little introduction to the Neil John MacLean Health Sciences Library. That's the library that I work in. I'm located at Bannatyne campus. There's a few librarians I work with, including Margaret, Maylin, and Christine. And, we add librarians to that roster. Every once in a while, we hire somebody, and that changes sometimes. There's a QR code there if you want to make an appointment to discuss a review or anything that you're trying to work on when it comes to searching. We're all really good searchers, and we'll trade some tips and tricks with you on how to get the best results. And that's for any type of review or assistance with using any library resource. We also have information about our hours. We have a great subject guide, subject help, lib guides, and systematic review. We have quite an encyclopedia of educational videos, tip sheets, links to key resources for systematic reviews, for scoping reviews, and for other types of knowledge synthesis. And as I mentioned, you can book an appointment with any of our librarians. At the Fort Garry campus, there's quite a few librarians in humanities, arts, social sciences, and law, for example. Many of them work out of the DAFO library, and so you can browse the subjects, everything from economics to zoology, and find your subject librarian, get some subject help, book an appointment. We also have the science librarians at this point are also, they're working out of the Defo library, and you can book time with the science librarian if that's which faculty you're in. And they're very good at helping you search the databases. Just a reminder too, that for the experience record, that's available for graduate students who register and attend all 5 sessions. Excuse me. So an outline for today's session. We're going to cover some searching basics, some concepts, how to turn your research question into identifiable concepts, how to find terms, subject headings, and keywords to describe those concepts and to search to support your research question to retrieve the evidence. Gonna have a little session, little chat about picking your databases. That's one of the things that people ask me about. One of the things that I see is that it's difficult. The University of Manitoba Libraries subscribes to over 600 databases. How do you know which ones are the right ones? I really am a firm believer in, picking the right collection of databases to search for your needs, and avoiding a lot of overlap. You don't need to search too many databases. You just need to search the right ones. Going to look at Scopus to do some background searching and how we can use that to identify some tools and terms and publications to assist with carrying out the full review. And have a little introduction to the OVID interface for Medline. And we're going to talk quite a bit today about keywords and subject headings and how they're both necessary for doing good searching to support your reviews. So the objectives for today, I'm going to share some tips for turning the research question into an actual search strategy that you can carry out successfully. Examine the differences and application of the keywords and the subject headings, because they're both very important. And going to cover some basics for developing a search strategy, from background searching to creating a better and more advanced search strategy. So what are these searching basics? One might seem obvious, but it's about knowing your research question, having a clear understanding of what you're looking for. We looked at some models, such as a PICO model, like identifying who your population, your intervention, your comparator are, for example. What are you trying to find? What is the evidence? And having clear ideas of that. And that's something that, your team works together to figure out what you're really looking for, what the parameters are for searching. It's also really important to just know your inclusion and exclusion criteria. That is something that, with the background searching in particular, you can kind of firm up that inclusion and exclusion criteria through doing some preliminary searches. And you can also make sure that you have good inclusion and exclusion criteria to register the protocol prior to doing your big searches. How to carry out background searches, that's really important. So I'm going to use Scopus as an example today. You should have identified what type of review to do, but often the background searches will help you figure out what are the types of reviews being done in your discipline or in your subject area. You might have an idea that you want to do a scoping review, but maybe there's a better type of review. So, those early searches can kind of help you identify if other people have done systematic or scoping reviews for questions similar to yours and where they're publishing, and also to just help you decide whether it's a scoping review or some other type of review that you might want to do. It's a good idea to have identified the databases to be searched. So once again, in the searching basics, you don't have to search 100 databases, but you might have to search several. And how do you do that in a systematic, efficient way to ensure comprehensive results? It's a really important part of searching basics is actually registering your protocol. And I'm going to talk a little bit about that. So first off, talking about know your research question. Very important to be specific, to clearly identify what you're looking for, who's your population or your patient population. And we talked in the last sessions, Maylin talked about the possibility of using a framework. In medicine, we commonly use the PICO model. And in scoping reviews, lots of times in population health, we use the PCC concept, and we talked about the spider framework as well. And if you need more in-depth information about those, you can go back and look at videos 1 and 2. They talk about that in a little bit more detail. And so you'll probably remember this was one of the examples that we put up of a PICO model. And the question being, what is the effectiveness of the non-surgical interventions on shoulder pain, range of motion, and function for managing adhesive capsulitis in patients with diabetes? So what I've done here is I've taken a good research question and I've broken it down into some of the concepts. So in green here, it's one of the concepts, looking at non-surgical interventions, looking at how it affects shoulder pain. Another concept would be perhaps adhesive capsulitis. So we're only interested in articles related to that as well. And the patient population as well, the concept here would be patients with diabetes. So that's 3 concepts that can help us build the optimum search strategy. Another example here is, what is the effectiveness of safe spaces to support youth mental health? So once again, I've identified some of the possible concepts, safe space being one concept, youth being another concept. That's our population, would be limited by age, and also looking at supporting mental health. What do we mean by that? So that would be another concept. And it's about bringing these concepts together in a good search strategy in order to answer the research question. So the inclusion and exclusion criteria, I've provided an example here. So if you think of that previous question about youth and safe spaces, how do you define youth? It's very important that your inclusion criteria clearly identifies your population. So for example, do you mean 5 to 12-year-olds? What about 12 to 16-year-olds? Maybe a different review would look at 16 to 29-year-olds. That's how they would define youth for the purposes of this type of review. Maybe somebody else would say anybody under 21. And it's about you picking your definition for your concepts, for your populations. And it's important to think about this early on. For example, maybe you're going to use Medline database, and maybe they have a filter by age, which they do, and maybe their filter for child is 6 to 12 years old. So maybe you want to actually have your definition of youth to be 6 to 12 years old, because you're going to use that filter. And it'd be if you didn't have, your population was 5 to 12 years old, you wouldn't be able to use that filter. So that could make a big difference in the number of results you get. And all you have to do is clearly define what you mean by each concept. And you need to report that and to put that in your inclusion or exclusion criteria in your protocol that you're going to register. So another example of this concept here, what do you mean by safe spaces? It's good to identify what you define as safe spaces. Does that mean recreation centers? Does that mean public libraries, recreation centers, the YWCA? Like, what do you mean by safe spaces? Is it programs, boys and girls clubs programs, community partnerships, community spaces? What do you mean? And it's good to identify this early on as part of your inclusion exclusion criteria and reporting it in your final analysis, because you might say, everybody on your team might say, yeah, we know what safe spaces are. They're this, and this. We know about that because we know about Winnipeg. There's lots of safe spaces for youth here. But you have to realize that people in the UK might have a definition of what safe spaces means. If you're looking for research in another area of the world, or if people from another area of the world are reading your report, your analysis, then you need to clearly identify what you mean by safe spaces for the purposes of reporting your results. It might be important to look at how do you measure effectiveness. Maybe that's important, maybe it's not. Maybe part of your criteria is it has to show some measure of effectiveness and it doesn't matter what the measure is. Or maybe you're working on using the criteria might be certain specific measures are acceptable for part of your inclusion criteria, and other measures might not be. Maybe you want quantitative data, maybe you want qualitative. The language of publications to analyze, good idea to decide this amongst your team early in the game. That the people who are doing the screening and doing the data extraction of these journal articles, that their professional language is, if you decide that you can work in English with English or French information, then that's good to know because you can include that in your inclusion exclusion criteria. If most people only speak English in their professional capacity, maybe you have to limit to English. All you need to do is report that and to maybe discuss that as a limitation when you write up the results. And these are good things to know because once again, you can use those databases to limit by language if you wish. And that makes it a little easier on the screeners. It's also really important to select, good dates for the studies and the reports that you're going to be studying. Maybe the last 15 years would work, 2010 on. Maybe you need to go back 25 years. Maybe 7 years is better. It really depends on your topic, and you usually have to have a rationale for which date you pick. But it can make a big difference, between having like 1,800 title abstracts to screen or having 3,300. And it might just be a little change in the dates. And it's about identifying sufficient evidence as well. So one of the things that people don't really think about in exclusion and inclusion criteria is the types of publications. And as a librarian, this is of interest to me. It's part of my work all day, every day, it seems. Certain databases are used for article retrieval. There's a big green check mark next to the word articles there because we're doing systematic searching to support systematic evidence synthesis reviews. And we need to be able to reproduce the search strategy, not only to run it just before we submit our analysis articles for publication, but also so we can rerun those searches or other people can rerun those searches in future years. So it has to be reproducible. It's just like a science experiment. You have to be able to reproduce it. Articles are diverse sources of evidence, but one publication type. And the databases are very easy to, we can help you set up how to store the searches to rerun them and how to report those searches as well. And so other types of publications that sometimes come up, people ask me about conference abstracts, or I ask them about conference abstracts. They hadn't thought about it. And so a lot of people say, yeah, of course we want conference abstracts. And then I'll say to them, well, you're searching in medicine or health sciences, means you're going to search Medline, that database, and you're going to need to search Medline's rival, Embase. And in Embase, about 30% of the records are for conference abstracts. And conference abstracts, on the one hand, may not have the depth of detail that you need to actually extract the information that meets your inclusion exclusion criteria in order to be useful information when you compare that to the depth of information that we find in a full journal article. If you have 3,000 titles and abstracts to screen and 300 are conference abstracts, And it may not be feasible for you to contact 300 authors of those conference abstracts to get the full paper, or the full information about the study. The abstract really has just a snapshot of some of the preliminary information, but it might not have the depth of detail that you need. So a lot of times people are screening conference abstracts and then they call me and they say, well, we need the full paper. We can't get a hold of it. And I say, well, you are looking at the full paper. It's a conference abstract. There is no 10-page paper. There's 2 or 3 paragraphs for an abstract. So that's really important to think up front when you're looking at your search strategies, because you can develop your search strategy in Embase so that you can eliminate conference abstracts. And so your screeners can focus on really where the evidence is. And I put books and book chapters up there as well. Once again, sometimes people say, oh, there's lots in the books, or you have to you have to include this book and this book chapter and things like that, or a certain author. And books and book chapters, they're not necessarily cutting edge evidence. We focus more on articles and reports of research in that format. If you're leaning towards books and book chapters as being a really important part of your search strategy, you might actually be better suited to doing like a narrative review, a good literature review. Part of the reason is you can't do the same reproducible systematic search for books and book chapters that you can do for articles. And remember, systematic and scoping reviews, they're really born in the health sciences and the sciences. So really, it's about looking at the research reports and articles. I have helped people working on like an environmental health type of review, environmental science review, excuse me, and they insisted on books and book chapters. So, I helped them design some search strategies, and we had to really work hard to like describe the methodology. To really have because we couldn't make it reproducible and like we could with the journal article searches, and it was a really big search and it added a lot of work to the work of the screeners. And I'm not actually too sure they used the books and the book chapters. I'm not sure any of that stuff really met the criteria for inclusion exclusion. And the other thing is that people don't realize that the heart of your review is often the research reported in the articles, but the books and book chapters can provide a lot of really good context for why it's important for people to read your review, and to provide some context and some rationale for why your work is important. And similarly, theses and dissertations have that kind of a role too. Some people, they want to know how to do systematic searching of the thesis and dissertations databases to identify those as well. Maybe they're important, maybe they're not. They do add a lot to your screening time because we're screening articles by title abstract. How do you do that with a thesis? And the same, to get into a thesis to find the data to extract comparable to how you would do it in an article, that kind of makes it a little bit problematic, makes things, it takes a lot more time and it's a lot harder to report. I worked with a team of people in nursing quite a few years ago, and they had, can't remember, hundreds of articles that they did title abstract screen. Everything went really good. It's a very highly cited review. And when I was looking at it, because I was on that team too, on that research team, I looked and I said, oh, it says here, you search for theses and dissertations. And I said, but you didn't. And they said, well, we have this table of 19 articles, 19 reports that made it into our knowledge synthesis and our analysis. And they said 2 of them are, I think they were theses. And they said, these are really important. We can't eliminate them. And I said, well, I'm not suggesting that. But when I asked them for a little bit more detail, they let me know that it was actually, they found the theses through the backwards and forward searching. So they checked some reference lists of some of the better articles that they had found for their analysis, and they were referencing these two theses in particular. And so they said, oh, that's how we found them. And I said, oh, okay, we just have to report it that way in your methodology. You can't just say you searched for theses and dissertations, because you actually retrieved them through checking the reference list. So it was just made a little difference in how we reported that in order to bring all that evidence together. Gray literature, a lot of people say, oh, yeah, you're going to find most of it, what you need in the gray literature. And that may or may not be true. It's not usually true. Most of the article or most of the evidence we find for most subjects is from scholarly articles. So gray literature, it's written in big red letters. Do you really need it? Do you need this? And this is the kind of thing you want to talk to your subject librarian about this. And, say, this is my review. This is my research question. Is there a need for any type of gray literature? And so for an example from medicine, when we're looking at a systematic review, looking at the effectiveness or the adverse events related to a particular medication for a particular patient population. So are unpublished clinical trials useful? And they may very well be. That's not unusual at all to actually do a separate search of the clinical trials databases to look to see if there's some unpublished trials that just haven't been submitted to an article, to a journal for peer review yet, but they actually are starting to report some results of especially some pretty big clinical trials. It may take a little bit of time to actually publish that information in a journal. So, and you do want the best clinical evidence for decision making. So people will look at clinical trials for that very specific type of systematic review. Other examples might be government reports. For example, if I'm doing something on epidemiology of a specific disease or diseases, I might also look for epidemiological reports that might have been published by health units and regional health authorities and provincial departments of health, for example, or the World Health Organization. And that might also be part of the evidence, but more than likely it's part of the context and rationale for covering for doing a systematic review or a scoping review on a certain type of illness that's transmittable. So government reports may or may not be important there, but often they're important for rationale. So non-government organization publications might also be a good example might be if I'm looking at interventions around cultural connectedness for youth, for First Nations, Métis and Inuit youth. I might, to support their mental health, I might look at some non-government or nonprofit organizations. They might have a huge research library of reports that they have done and models, and it may or may not be used for the analysis, could be used for the rationale, or it could be used for, okay, we've proven that this is a big issue, that students who are firmly connected to traditional ways and their culture do better, they have healthier lives, and the NGO reports might be part of the solution. Here's some examples of how you can support healthy initiatives for youth in your community to support cultural connectedness, for example. So background searches, I put the title of this slide, background searches in 1 or 2 databases. So you don't need to do background searching in like 10 databases or even 5. 1 or 2 databases is lots. And the background searching that I might do for a research question might be different than what you do based on our research questions might be very different from different disciplines or on different topics. The one I'm going to show you today is I'm going to show you how to use Scopus to do some background searching, and what you will find in Scopus that's going to help inform better search strategies for when you go in and do the primary data collection of publications from some of the other databases. Some people in arts humanities might use EBSCOhost. There's a suite of interdisciplinary databases. I know when I'm doing work in Indigenous health, I'm all about interdisciplinary work. So I often will go and do my test searches and my background searches in EBSCOhost first, or sometimes Scopus, depends. And same if I was doing my research question was maybe about interventions for IPV. I might, or intimate partner violence, sorry, IPV. I might actually try EBSCOhost first if I'm looking at interventions to support, say, women enrolled in prenatal care programs, for example. Medline is also a very good place where if you're doing medicine or health sciences, you might want to do your preliminary searches in Medline. And it's a way to test some of your search strategies and also to look around to see if there's other terms or other words that you should be using in your search strategy. So you never just say, okay, I've designed a search strategy today. I'm going to take a look and I'm going to run it tomorrow. You actually need to do some testing first. So these are places that you might want to do it. Some people might pick Web of Science instead of Scopus, for example. If I'm doing a nursing research question, I would obviously pick a nursing database, CINAHL being a really good place to start and start looking around to do some draft and preliminary searching. Some topics or research questions are very specific. And so sometimes I'll even look at Google Scholar and do some preliminary searching just to kind of get an idea on, is anybody talking about this? Has anybody published any research that's very specific? If somebody has a very specific research question, sometimes we'll just look to see if anybody else has connected the same concepts that they have. So picking your database is also very difficult to do. How do you do it? There's over 600 databases at the University of Manitoba Libraries. So how are we going to do that? And so the University of Manitoba Libraries has a number of LibGuides that the specialist librarians have each done. So I've done one for Indigenous health. Maylin's done one for pharmacy, for example. My colleagues have done them for various aspects of engineering, sciences, social work, Indigenous studies. There's a number of LibGuides, and often they'll have, 5 or 6 databases listed, sometimes more, but they'll often have an idea of, best picks are this. It's really important that you use this information to understand the differences and strengths between one database and another in the same discipline. So, how does Scopus differ from Medline? If I search Medline, do I need to search Scopus too? What's the difference? How do the databases work? What syntax or truncation would you use between one database and another? You really want to know what's the overlap. You will probably use software such as Covidence to deduplicate, to remove the duplicates between of the records and the publications you've identified between one database and another. But you want to know what the differences are so you do avoid duplication. It's about systematically picking the right databases for you and for your research topic, your research question. It's about carrying out systematic searches. It's not, you don't want to just search everything. You want to just go in and search specific databases in a systematic, reproducible way. So you can always ask your subject librarian for advice. We're the people that develop those LibGuides. And, we can give you like our top 3 or 4 picks. So you don't end up searching 11 databases if you really only need to search 4, and to develop very smart search strategies. Look at the other thing that great way to identify which databases to search. Look at other reviews in your area similar to your topic. And I'm going to show you how to retrieve those and identify those today. And often they have to report which databases they chose. They have to report what their search strategy was, what subject headings did they use, what terms and keywords did they use. So more on picking your databases. As I said, Medline for medicine, CINAHL for nursing. Embase is Medline's rival. So Medline has 30 million records. Embase has 40 million. And there's a certain amount of duplication between those databases, but they also have unique records. Web of Science is also a good database. People often use that instead of Scopus. I prefer Scopus. Other people prefer Web of Science. They each act a little bit differently, have slightly different collections, and they would be useful for different circumstances. PsycInfo, if you're doing psychiatry or psychology, that would be one that would be useful for you. And there are some other databases too that I haven't listed everything here, which is why it's important to maybe ask a subject librarian or check out those subject guides to identify the best databases for you. And from Maylin's session last week, I discovered that we have food science and technology abstracts on OVID as well. I didn't know that before. So it's actually a pretty small database. It only has 2 million records, but some of them might be unique. I wouldn't use it for nursing, but I might use it for something in the food sciences. So search basics, just a reminder, we learned in one earlier session that you really need to register your protocol. So if you're doing a scoping review, a good place to register is OSF. If you're doing a systematic review, a good place to register is Prospero. Yeah, they're very specific about what types of reviews. Prospero is very picky about it wants to only have systematic reviews registered there. Both places to register are free. You just have to write your protocol. And a little bit more about where does it fit in when to register your protocol. So you want to register it after you've done some background searching. So do some background searching, know your research question, know which databases you're going to search. So register the protocol after you've selected the databases, but before actually carrying out the searches. And you also register your protocol after you finalize the inclusion and exclusion criteria. So the research question, the concepts, the search strategies, the inclusion and exclusion criteria, they're all working kind of together. Knowing your research question helps you with the concepts. Knowing the concepts helps with the search strategy, and helping with the inclusion and exclusion criteria. But always register the protocol before you start collecting the data. So that's before you carry out those final searches to actually identify, download those records, RIS files. So you want to do it. You want to register, your protocol, have a clear record, a public record of what your inclusion exclusion criteria is before carrying out your searches. And if you don't do that, you can run into some real problems when you go to submit your analysis for publication if you haven't registered the protocol. People sometimes forget, or they sometimes do things in the wrong order. So we're going to talk a little bit about concepts. This research question is, what is the effectiveness of safe spaces to support youth mental health? So concept number 1, safe spaces. And we put that together with and. Concept number 2 is youth. And concept number 3 is mental health. And we'll look at maybe variations of that. So that's your concepts. You break down your research question into concepts, and then you design search strategies for each concept, and then you bring them all together. So what is the effectiveness of those safe spaces to support youth mental health? And here, so concept number 1, and these are some keywords. So I said safe space with a little asterisk, safe space or safe spaces. Double quotation marks can help search a phrase. That's helpful in some databases. You always have to know what the syntax is for each database. Some of them are the same, some are different. Community center might spell center this way or that way. So we want to make sure we have both. I could have also done community sent with asterisks at the end, but it might have picked up some stuff that wasn't necessarily about a community center. It might have been community centered, for example. Recreation center or centers again, leisure centers. So these are some keywords. You are listening to your team. They said, okay, here's some different terms that we might try for safe spaces, safe space. And so this is what you might start with. It's just some good keywords. Different variations. Okay, if we were looking for youth or youths, might be spelled with an S, or adolescent, might put an asterisk there, or teen, we'll retrieve teen or teens, or teenager or teenagers, or teenaged. Child, for example, with an asterisk, will pick up variations of the word child. And once again, we use an and here for the third concept, and might start with something really basic like mental health or mental illness with an asterisk or wellness. And we could expand on that later. This is just some basic keywords to kind of find what's out there. Now, we've built up our space or our search strategy a little bit now. This shows you that all of these terms, these are just keywords. It's not unusual for example, if you're looking at mental health, you think, oh, I'm going to look in a good medical database like Medline. There may not be a subject heading for something like safe spaces. There may or may not be. But it's not unusual that sometimes when your term doesn't have a subject heading, it doesn't have a clearly defined subject heading. Youth, for example, in this one, we still have the keywords. So this line is keywords, but we also have some subject headings, and I've pulled them from OVID, from Medline. OVID subject headings in Medline are called mesh. In Embase, subject headings for Embase are called Emtree headings. They're from the thesauri for mesh and the thesauri for Emtree are different. And this slash here, that's a particular function. So in Ovid, when you see the slash, it means that's a subject heading. So it acts in a different way than here, youth with a little asterisk. That's a keyword. So these are useful. And like I said, you're probably going to look around for other systematic reviews or scoping reviews on similar topics to yours. And when you go and look at their search strategies to help inform yours, it's helpful to know what the slash is. So you can say, oh, those are the subject headings, and you can kind of make a note of that because that will make for a stronger, more efficient search for you. Mental health example, there's some keywords that we used, but we also used perhaps some subject headings. And so the keywords are noted in red. They're different than the subject headings. Keywords are the terms that you and I are using. We hope that our peers writing on the other side of the world about the same thing we're writing about, they're probably using the same keywords, but you need to add in subject headings to make a little bit stronger search. And if you think about a subject heading, how would it be different from a keyword? A subject heading is it's a specific name or label or tag that has been designed specifically to identify certain information. So if my name was a subject heading, probably the subject heading would be Janice Sylvia Linton. So it'd have my first, my middle name, and my last name. But it would be connected to people who were looking for information under my name, Janice Linton, or my name, Jan Linton, or Janice S. Linton. They would all find it using that subject heading, the controlled language of Janice Sylvia Linton. That would be the controlled subject heading. And the other terms would be terms that could be used to retrieve information under that main subject heading. So we're going to look at Scopus. Scopus is kind of my playground. I like to just do a little bit. I always do background searching. I help students on all different types of questions every day. And so I I know how to search databases, but I don't know about everything in medicine and health sciences. So I do background searching in Scopus. Scopus is interdisciplinary. It has 90 million records, so that's a very, very big database. It includes all the Medline records and all the Embase records. So it includes the 30 million Medline, 40 million Embase, so that's 70 million, but it takes out the duplicates. So it's probably about 45 million records from the two main biomedical databases. And then it throws in another 45 million records to research in all different things like the sciences, engineering, very good for technology, pretty good for social sciences. Not my first place to go, but it certainly has a very interdisciplinary perspective. And yeah, it's a very good database for just practicing some searches using the terms that you're familiar with, but to help you identify terms that other people might be using in their publications. So good place to start. Really focuses on keyword searching. It's not so much about subject headings. And we're going to look a little bit when we compare Scopus to OVID Medline today. And so really about keyword searching. You're trying to find you're trying to find the work of your colleagues and your peers. And hopefully you're all using similar terminology to help identify their work. As mentioned, interdisciplinary. It could be used for pretty comprehensive literature searches for scholarly journal articles. Depends on the topic, depends on how good your search is, but you can get a pretty good comprehensive search from Scopus for a lot of topics, not all of them. And but you can't use just Scopus. You can't search just the one database to say, oh, I've searched Medline and Embase. I've only searched Scopus. You really do need to search more than one database. So usually 3 or 4 databases is a good start for the actual data gathering for the systematic review. You might want to expand your searches to other databases. So this would be very important for a systematic review or a scoping review. You need to go beyond Scopus. So you might actually do a search in Medline or Embase separately because you have subject headings here, which can be very helpful. They can be very strong to retrieve the right results. Whereas Scopus is pretty big and a little bit loosey-goosey because it's dependent on the keyword searching. And for example, if I was doing a research question around global health, I would probably want to go and use the global health database, the Medline database, and Embase as well. PsycInfo is also on OVID. So some tips for using Scopus. Use the double quotation marks. That helps for phrase searching. So a phrase is 2 words together to make a concept. So for example, First Nations, when I put this together with double quotation marks, clearly will retrieve information relevant to the concept of First Nations people. It will, you can use population health as another example, knowledge translation. These are all 2-word phrases, and your searching in Scopus is more precise when you use double quotation marks for 2-word or 3-word phrases. The asterisk is another cool little rule that we can use, a little tool in Scopus. And so you put a little asterisk there, and for example, it'll pick up Canada or Canadas or Canadian or Canadians. In Scopus, I also suggest sorting the results by relevance. And it's good. These are good limits to apply. There's 1, 2, 3. There are other limits. Some of them work better than others, but publication date is a good way. Document type, maybe limit to articles or reviews, for example. And also for a lot of research, it's published in multiple languages. So you may want to focus on the language that you're using professionally. So as I mentioned, Scopus relies on keyword searching. So it's good, it's big, but it's really depends on what you type in. And I wanted to mention too that on the subject guide on the website for the Neil John Maclean Library, when we talk about we have a knowledge synthesis section, and that's where the videos and the slides for today's sessions are posted. And I've also put up a couple of handouts, one to help you search Scopus, so in a little bit more depth and detail than I can present today. And I put up a second handout on how to search OVID, so you don't have to take so many notes. So background searching in Scopus. Once again, we're looking at safe space. So I put it in double quotation marks, for example. I put a little asterisk in there as well. So it'll pick up safe space or safe spaces. My other concept is review. With Scopus, you get one row. It's kind of googly, but I've added a second row. So I've got one concept up here looking for safe spaces. But my other concept for this particular search, just looking for some reviews for people who've done research around safe spaces. And so I'm going to actually look for reviews in the article title. I'm going to combine that with safe spaces in the article title. Just pick up a few reviews to help inform my search. The other thing I was going to mention is it's a good idea to get an account. If you haven't searched Scopus before, once you go into Scopus, you can actually sign up for an account using your University of Manitoba email, your own password, and it's kind of like having your own little filing cabinet of resources. You can save searches. You can do a search today and save the results, and then maybe go through and look at some of the articles a little bit more closely tomorrow. You can email some of your results to friends and say, oh, I've found 6 good articles. Let's get together next week and talk about them. There's lots of different things you can do. So registering for a Scopus account I've found is very helpful in my work. And once again, for Scopus, go in and look at the results page. And there's a safe spaces for youth mental health. It's a scoping review. And I think, oh, that was my research question. Well, this is just the title of the review. It follows the Prisma guidelines that you identify what type of review it is in the title. Put a synopsis of what it's about. It's not the whole research question or questions, but here it is. The research question has been collapsed down into a good title, clearly identifies as a scoping review, fairly recent, in a good journal, PLOS 1. So I would probably go in, take a closer look at that scoping review. I can use that information to look at their research questions. Are they different than my research question? Maybe discuss it with the team. Maybe this is a really good review I can take back to the team and I can say, this is a new current review. We won't be able to do a review on the same research question if the research questions were identical, but maybe it would help inform doing some original research. Or maybe you can use this information to say, well, our review is actually a little bit different, or we're going to change our review. So it's not about youth mental health. Maybe we're going to look at safe spaces for Two-Spirit LGBT youth, for example. So maybe we won't look at youth mental health. We'll look at a different population, for example, and we'll look at maybe characteristics and effectiveness of safe spaces for a different population. And you also want to look at what methods did they use? What databases did they search for their review? What terminology did they use? Did they use subject headings? Did they use keywords? What's their methodology look like? How many items did they get? Did they retrieve 30,000 or 3,000? That can kind of give you an idea on the quality of the searches. And they will have a documented history of the searches that they carried out, which can help inform you to figure out, oh, which keywords should I be using? Have I used enough subject headings? So it can be really helpful information. And here's another example. Somebody else did something on safe spaces. They did theirs as a literature review. So maybe I don't need to do a scoping review. Maybe a literature review might be more in line with what I need to do. This one here talks about it's just a review. So it's like a narrative type review. Oh, in fact, this is a book chapter. But that might be something different that you can do. You can still bring together the best literature and a synthesis of the literature and an analysis of the literature. She might not necessarily do a scoping review. You might do a different type of review. And I suggest that Scopus is a good place to look for other people who've done reviews in your area, because you may find, oh, in our discipline, not that many people do scoping reviews. They do actually narrative or literature reviews. Here's another example of doing some background searching. So I'm going to look for any systematic review, so singular, the word systematic review or the term or scoping review in the article title. And this would pull up a lot of systematic or scoping reviews in Scopus. And so here, for example, I might be doing, there's a concept I'm looking for review in the article title. And maybe I'm interested in motivational interviewing. Maybe I've got a research question that I'm working on, or I say, gee, I'm interested in motivational interviewing, and I'm interested in that with a specific population. So I might look for motivational interviewing. It's one of my concepts in the article title, and I'm looking for reviews in the article title. And here's, for example, somebody did a meta-analytic review of CBT and motivational interviewing. There's their patient population, young adults with sleep concerns. I can see which journal it was published in and when. This one here, motivational interviewing and exercise, a systematic review and meta-analysis. So it's slightly different than this one. This one's motivational interviewing in obesity care, and it's a narrative review. So once again, you could look at those reviews for a couple things. How do they differ as reviews? What was their search strategy? Did they document the search strategy? Because you can just because you're doing a narrative review, you still can do systematic searching, and you might still describe what databases you chose, what terms you used, how many results you got. But it's a narrative review, so it's not as strict with reporting guidelines as a systematic or a scoping review, but it still provides a good publishable review that will inform other areas of your research, for example. Also, you can see where these were published, and you can go in and find quite a bit of good information that will inform your methodology for the review that you're doing. Here's an example of an article. So we've gone from the list on the previous page, we've gone into the record for one of the articles in Scopus, and there's quite a bit of information here. So we can see the journal, and I thought, oh, I don't know what the Journal of Dual Diagnosis is. I haven't used that one before, but they did publish a systematic review. It's on motivational interviewing, which is what I'm interested in, and dual diagnosis treatment. Maybe I'm interested in that, maybe not, right? But there's a lot of information here. We talk about in systematic and scoping reviews, we talk about doing backwards and forward searching, especially in scoping reviews. So what does that mean? It means maybe taking a really good article for perhaps a review, and we might look at the references listed in the review, and they would be found in the Scopus record. So all the items referenced in this review, they would be in the Scopus record, and you might take a look at that list to see, oh, is there anything that we missed, for example, when we were doing our structured searches in the databases. Or you might look at some of the references. Maybe there's some other keywords that you might want to use. Here it's cited by one document. So even though it's a fairly new review, somebody has cited it already. And that's what forward searching is. So Scopus helps you to identify the backwards part, the references used, as well as who cited it. That's the forwards part. And this can be helpful for just picking up a few more items of evidence, research reports that might be useful for your analysis, the synthesis of your information, of your research question. Further down in the record, so this is the second part of the record, there's the abstract. And I picked this one because here's some information about the rationale, but I picked it mostly for this. So here they describe the method in the abstract. This is a very good structured abstract. They talk about the systematic literature search they used PubMed to search Medline. They used Web of Science and Scopus. So that gives you an idea of, oh, those three databases. Maybe if I'm doing research on motivational interviewing or dual diagnosis, maybe those are good databases to make a note of. They used the Prisma reporting guidelines, so you can see how they did that. You might go in and read the article for that. They talked about how their final selection for the review comprised exclusively of RCTs comparing motivational interviewing alone or integrated into routine care. All patients included in the studies were over 16 years old, and the study's quality assessment was conducted with a jotted scale. So this gives you a lot of information. Like these are their inclusion exclusion criteria. So it helps you to go in and see how did they write up their inclusion and exclusion criteria? How did they define things? They did a quality assessment using a certain scale. Go in and find out more about that. The results were 8 RCTs included in the review. So 8 of the 16 or 8 of them actually met the criteria for inclusion, and you can see how they laid out their analysis, what terminology they used. There'll be a ton of really good information in there, and maybe they had some missteps, but you might be able to say, oh, well, I like the way they reported this. I'm going to go ask the librarian, should I be using PubMed or OVID Medline? Maybe there's a reason why we would use one over the other. The librarians at the Health Sciences Library, we like to use OVID Medline rather than PubMed because we have more control over the search, and we can do much more stronger, more efficient, more effective searches because we have access to OVID Medline. And so there's quite a bit of information there. And once again, what's in this record? So there's different sections for different types of keywords. So the author who wrote the paper or authors, there's their keyword. So they said, this is what my paper is about, dual di, medication compliance, MI, etc. But they also have indexed keywords. And this is really important. This is one of the reasons I use Scopus. It really helps me identify which keywords. So if I click on this drop-down menu, it brings up this. So there's my drop-down menu. It's dropped down. So in Medline, so this record is in Medline. That's why it has some mesh medical subject headings. It's also in Embase. So there's the Emtree terms. So the thesaurus in Medline has mesh terms. They are different than the thesaurus in Embase, which uses its own medical terms called Emtree. So in this case, the author said it's about dual diagnosis, but the medical subject heading is called diagnosis, dual psychiatry. So it's quite different. So if I was only searching for this in Medline, I might miss a whole bunch of stuff that didn't use this term, but had this label put on it. So it might have used a different term. And this is how the controlled language makes it so that we don't miss anything and that this is like a controlled language that the index brings together people that might use this term and might use a different term, but we're all under the same label here. Also, there's some other motivational interviewing is a medical subject heading. I wouldn't have known that. So that really helps me say, oh, I could really focus my search to answer my reference question, my research question, and focus on motivational interviewing. There's some other subject headings here that might be useful. There's drug terms if I've got pharmaceuticals, for example. And there's the Embase terms. In Embase has more records. Medline has 30 million, Embase has 40 million, and Embase indexes things differently. They have more subject headings, and they apply more subject headings to each article to describe it. So those are kind of differences that do affect your results. So here again, there's a big list of the Emtree medical terms and motivational interviewing and motivational interviewing. So the subject heading in Medline and the subject heading in Embase happen to be the same, and they happen to be the same as what the author's keywords were. That is not usually the case. Usually the dual diagnosis situation is what we see, that the medical subject heading is a little awkward, and the entry term in this case is dual diagnosis, which happens to be the same as the author's keywords, but that's not always the case. The subject heading for Embase and the subject heading for Mesh for Medline are usually different. In this case, they happen to be the same. So going to bring some examples forth from science. Same Scopus searching can really help, and I'll show you. It helps in the same way, it just looks a little different. So here, looking at some reviews, this one is a review. This one's a critical review. This one's a systematic review. This one's just a review. And one or the other method might be what you need to use. When we go into these records from the sciences, for example, in transportation research, so a lot of the same information that I just went over for medicine applies. There'll still be a reference list down here in case you want to look for some other related materials that you might want to know, or some keywords. Anybody that has cited this, it'll be listed up here. There's an algorithm here for related documents according to what Scopus algorithms have been set up. So these are all helpful to find more literature, more evidence for your synthesis. Once again, there's author keywords to describe the article. The indexed keywords, so we drop down this to look at the indexed keywords. They're from an engineering database. They're engineering controlled language terms. So traffic flow theory, traffic simulation, the controlled language was very awkward, wasn't something that rolled off my tongue. It's automobile driver simulators. But this would make for a stronger search when you use the subject headings or the keywords when you're searching the engineering database. So this is kind of a neat way to sort of pick up some ideas for how you can make for a stronger search when you go to the engineering database and do a more structured search. In engineering, I learned from this, there's controlled terms of subject headings, but there's also uncontrolled terms, which are just similar to keywords, I believe. And so if I was in engineering and I wanted to do a search similar to this, I might go in and do some background searching in Scopus, identify some terms, and check the LibGuide for engineering, or a certain type of traffic flow theory, for example, and look at the different options for searching 1, 2, 3 databases, and maybe ask the librarian for some tips on how to do effective searching. So take a little break between Scopus and Medline. So Scopus, we were in Scopus, and we're going to go into a very different looking and feeling database called OVID Medline. So now we're going to go into OVID Medline, and I'm going to show you some differences between the keyword searching we did in Scopus and the subject heading and keyword searching that we might do in Medline. So there's a reason why, one of the reasons we like to search OVID is, in medicine, we usually have to search, if for most medical and health sciences questions, we have to search Embase because it has different materials than Medline. And it really makes for a much better review because we've really say that we really have gathered all the evidence for the knowledge synthesis. So because I've got to search Embase, I can search Medline on OVID as well, because they're both in OVID. And I can take elements of my Medline search that were successful, and I can replicate them in Embase. And it makes for a more efficient, more effective, more comprehensive searching, and it's a little bit easier to do. As I mentioned, the subject headings are different for each database. They're totally different. So when I translate, I run my search in Medline and I refine it, and it's a beautiful search. It's going to look different in Embase, but it's also going to look different in PsycInfo. For some of us, we're not doing psychiatric or psychological questions, research questions. So we might say, well, I'll use Medline and Embase. And in medicine, a lot. I just use Medline and Embase, and I maybe throw in a Scopus search too, to retrieve articles. But sometimes I just use Medline and Embase because it's pretty simple. And you can really you can easily identify all of the literature in a systematic way. The searches are reproducible by other people who will be reading my review and peer reviewing my review, and me perhaps even doing an updated review in a few years. Global Health is also in OVID Medline, and it uses a different thesaurus, as does FSTA. So the way I start looking at OVID Medline is I want to explain. In Scopus, we looked at a record. We could see what elements it had, the references. It had some backwards and forward searching, so we could look to see who had referenced the article. So I want to compare that to what a Medline record looks like. So a Medline or an Embase record looks pretty much the same. This one has tuberculosis highlighted in yellow, and that's because it highlights the terms that you searched in the fields that you searched in. So I actually, part of my search strategy was I searched the word tuberculosis in the title field. That's why it's highlighted here. It's TB diagnoses following wildfire smoke exposure in California. There's a lot of information here. Most of it I don't really need right now, but just gives you an idea of what areas, like it's a pretty big record. But it's a lot of very specific information about authorship and also which journal it's published in. So further down in the record, so this is more of the record in Medline. There's the journal name. But here, there's the medical subject headings. So we looked at medical subject headings in Scopus. Here's the medical subject headings, and they're given sort of a hierarchy. So this one has an asterisk in front of the W for wildfires. And in this case, this article, it's focused on wildfires. It's focused on air pollution because the asterisk is in the front. So the three concepts, when we talked about concepts, it's mostly about wildfires, air pollution, tuberculosis, air pollutants. The other subject headings, because these are all subject headings, these are the kinds of things that you can use to refine your search. So if you were working on, your research question was around rabies vaccines, you might want to say, well, I'm going to use the check mark or the limitation to human studies because I don't want animal studies, for example. So this gives you an idea of how you can refine your search so that you won't end up with 8,000 articles in your search strategy. You can use some of these limits and filters and hedges to help you to do a better search. So that's why I'm showing you this record. There's those keywords. These are the author keywords. So the author has said air pollution, outdoor air pollution, climate change, tuberculosis, and wildfires. Most of these are the same as the main concepts that have been used to describe the article up here. But the author actually said this is about climate change. And the subject headings actually didn't note climate change. So that's kind of interesting too. So that's why when we search using keywords, we'll pick this one up. When we search using subject headings, we'll put pick this up. So sometimes there's a little bit of difference, and this really helps us to identify all of the research so we can feel really confident that we've done a comprehensive search. Here again, it's highlighted in yellow because these were found in the abstract. My search strategy was looking for the word tuberculosis in either the title or the abstract. And this is how you can build your search strategy. So for example, if I look for the word tuberculosis in the title field, it only searches for this in the title. And this is a way to make your search more sophisticated and stronger. You might search for tuberculosis in the abstract. MP it'll search for this word in multiple fields. So multiple parts of the record. In this case, we can say, we'll look for tuberculosis in either the title, comma, or the abstract. So this is the syntax. This is the formula that you need to search a word in two different areas with a little comma in between. And this is tuberculosis with a slash. And if you remember from a previous screen, talked about how in OVID, when you see the slash, you know that it's searched tuberculosis as a subject heading. So this is the strongest label, but these are also important. And you need to use a little bit of this and these as well in most searches. For some of your concepts, sometimes all the concepts, sometimes just some of the concepts. And these are the common fields. You can search, there's a whole bunch of fields in OVID. The manual is about 80 pages. Well, I've synthesized it down to one chart that shows you the most common fields. And these are the ones that you want to know because remember when I said in Scopus we could find other people that had done systematic or scoping reviews similar to ours? They will have their published search strategies as perhaps a supplementary file to the main article or within the main article, but the search histories have to be reported if they're going to do it according to, say, for example, the PRISMA reporting guidelines. So this is the type of information that you want to take a look at so that you can peer review their search, but you can also learn from their search, like, oh, they did use subject headings or they didn't, and you look at a lot of different information to help you do a better search for your research question. And we're going to talk about the strength of subject headings again. So I use this as an example of how you can understand what a subject heading is. So it's a label or a tag that you use to identify. But there's an option to explode the subject heading. And I thought, wow, that's a weird term. What does that mean? And so in this case, it shows that Canada has a whole bunch of different territories and provinces. And if I explode this term, it will pick up the 105,000 articles with this tag, the tag for Canada, or the subject heading. And it'll also pick up, if I explode it, it'll also pick up all these other kind of sub areas or my more finite, more precise types of, in this case, it's regions in Canada. But when you think about it for science or health sciences concepts, it can pick up a lot of different stuff. So if I hit explode, it'll pick up the 105,000 here, as well as all these ones down here. Somebody else might say, well, I only want the label if it only says Canada, so I'm not going to explode it. I'm going to check it off here. I don't really care about these little studies done in different provinces. So they might say, I'm just going to check off this one. I'm not going to explode it. Somebody else might say, well, I'm going to use it to focus. So I don't want the ones under here. I just want to really focus on Canada. And so that's the example of, in the previous slide, the asterisk was before the term wildfires. So it says, the article has to be about this when I focus on it. It's not just mentioned in the article, it's actually focused on it. I don't use the focus limit very much at all myself. I do use the explode one I don't use it on every concept or every subject heading. I only go in and I'll show you how I do that. The other thing that the thesaurus, so this is part of the thesaurus. The example is Canada, but it could be I can't remember. There's thousands and thousands of terms in each of these thesauri. So it helps you because you can kind of look up and go, oh, maybe I should focus on North America, not just Canada. Or maybe I'm interested in Canada or the Arctic regions, or Canada or Greenland or Arctic regions, for example. This can be helpful so you to say, oh, I'm interested in certain areas. And when you go into different areas, there's a lot that can be found underneath. This is just an example from regions, but it gets really exciting when you're looking at different concepts in your area of discipline that support your research. So back to a PICO question. How do we take a PICO question and turn it into a search strategy? So we're looking at patient population of humans that have been bit by a tick. Let's look at an intervention for antibiotics and comparators to those who have not developed Lyme disease. So can Lyme disease be prevented by treatment with antibiotics after tick bite? So our concepts, Lyme disease, looking at prevention, looking at antibiotics as the treatment, and it's about tick bite, after the tick bite. So we've taken the PICO model, we've taken the research question. So this shows you the relationship there. This can help you write a good research question, or the research question can help you write a good model or framework for describing what you're interested in and helping with that inclusion-exclusion criteria. And these are the concepts. So we've got it all here, the research question, the PICO model, and the concepts. And you might say, well, how do I use it in search? So this is an example. We've gone into the OVID databases. Specifically, we are in Medline because we've got a medical topic. And I would just type in my first concept. We automatically will map it to the subject heading, and we'll let the index do that. And so it says there's Lyme disease. It's in the list. And information over here, there's a scope note. So if I say, what I think of as Lyme disease, does the index describe it or define it as the same as I do? Lyme disease is a pretty specific diagnosis, for example. Hopefully these would be the same, but sometimes you open a scope note and you go, oh, I didn't think of that, right? And the scope note has defined your concept differently, and that can happen. So what I recommend to everybody is that you drill down to find out a little bit more about Lyme disease. And this is where you're going to see the power of the subject headings. So here is an example of a scope note. So that was the part from over here, the scope note, and it explains what it is. It explains when it became a medical subject heading, a term, what it was called before, perhaps. Other references. Now, these might be helpful for you to develop your keywords in case there is publications in here that haven't had that medical subject heading applied yet. And that can happen with newer literature, for example. So we're going to drill down. A lot of people look at the scope note, which we just did, but we're actually going to drill down. So let's see what's there. So here we are in the thesaurus. So this is similar to looking at Canada and the little provinces underneath, right? And there's some very important information here. So here you see it within the structure of medicine. You know, these might be related concepts around it. They're similar types of infections or diseases. Here we can see, this is also important information. We can see how many articles in this big database of 30 million records, 10,000 are about Lyme disease. So there's 10,000 there. We can decide whether we're interested in just Lyme disease or various types of Lyme disease. So I might check off the Lyme disease to pick up the 10,000. And I might check off, well, I'm interested in post-Lyme disease syndrome, even though there's not a lot of records about that yet, because it might be a newer term. I think, well, I'm interested in preventing this as well. So maybe I'll include those records. As I mentioned, explode. If we tick off this box, it'll retrieve the records under Lyme disease or the 3 labels underneath it, the 3 subject headings underneath it. So here we've decided to explode Lyme disease. So we've picked up the main heading plus the 3 that were underneath it. Now we're going to do a keyword search. So the keyword search is Lyme disease. That's what the team calls it. And I've picked off a couple of terms that I saw in that scope note that I've actually done a little bit of testing over in Scopus, and I've identified these. And so they might be useful. I've decided I'm going to search in multiple fields. So it's only 3 keywords or 3 terms, but I'm going to search in multiple fields. So I would combine the subject heading or the keywords. So it'll pick up different records about the same topic. So 1 or 2. I would check off the box here. I would check off the box here. And once I did that, I could activate either the and or the or button. But of course, it's the or button because this is concept number 1 is the disease. So subject heading or keyword, hit the or button. And then I would look up my next concept. So we talked about antibiotics for prevention. So I look up antibiotics in the same way, maps it to the preferred term, to the medical subject heading. I never would have guessed antibacterial agents. So I think, oh, never thought of that one. So once again, I would drill down and I would look at, so imagine that I've drilled down and I've pulled up the antibacterial agents. And what I did was, because I had done the drilling down, I exploded it because I said, yeah, I'm interested in antibacterial agents and all the little ones underneath it. I don't have a picture of that on this slide. I'm going to explode it to pick up all the different types of agents. And I'm also going to select searching antibiotics as a keyword. They've recommended multiple fields. They've recommended use the or. So I just check off the boxes. But I can do that because I've looked at that antibacterial agents and I've looked at that in the thesaurus and I've agreed that I want to explode it. So here it takes us back to our search again. So we've got concept number 1. We've got a second concept. In this case, the subject heading is on one line. The keywords are on another line. We've ordered those. In this case, just shows you a different way to do similar information. There's the keyword or explode antibacterial agents. So I've done the subject heading and the keyword in the same line. Up here, I did the subject heading on one line, the keyword on a second line. And a lot of times people like to do it this way because it's easier to see and easier to identify if there's been a mistake as well, right? But you can do it this way as well. Now we're looking at that third concept, looking at maybe prophylaxis or prevention. Once again, I've looked a little bit at, tried to look up the term prophylaxis or prevention. I've done some testing and I've decided that keywords are going to work better. I was surprised by this, but this was a real search I did a few years ago, that prevention or prophylaxis as a keyword was actually the best search. There wasn't a good subject. There was subject headings, but they didn't have smaller terms under them. So this will pick up in the field for the title, the abstract, or even the subject heading field. And I think there was a subject heading for one of these. I can't remember. So here we bring our 3 concepts together. We've got the disease, the intervention, and the prophylaxis. So we said, check off this concept, and this concept. And we put them together with the term and. So there, number 3, line number 4, and number 5, 3 and 4 and 5. So when we put those check marks in and hit and, there it generated for us. So out of the 11,996 articles on Lyme disease, for the subject heading, or 17,000 when we used subject headings or keywords, combine it with the other concepts, we get the 522 articles that are most likely to meet our inclusion and exclusion criteria as far as the search is concerned, right? Because we didn't have a specific population. It wasn't just adults or children. It was all about preventing Lyme disease after the tick bite. And then just showing other searching that we might do or other investigation we might do. So back in the thesaurus, we might look at ticks or tick bites, for example. Those would both be maybe found in here, but sometimes you look around and go, okay, I've got the Lyme disease down, but maybe I should look at ticks or tick bites, for example. So this shows you, once again, how the thesaurus might work on a different concept, but it's a related concept in this area. In this case, I decided to explode it because I wanted these specific types of ticks and the ones underneath. And that's the end of our session today. On the next session, we're going to do more advanced searching. We're going to say I'm going to show you how to test to see if your terms are actually fruitful or not. Some people might use 5 keywords or 7 keywords, and they say, oh, I wonder if these 2 keywords are actually helping or not. I'm going to show you how to do some testing. And so you can see, and I'm going to show you how to do sophisticated searching, how to easily capture your search strategy for your search history, how you can rerun the search very easily by storing the search. And then say 5 or 6 months from now, when you've done the analysis for most of the articles and you're writing up the results, you might want to do an updated search just before you send it in for publication to see if there's maybe another 20 or 30 articles that may or may not meet your criteria that you might want to look at, of which 2 or 3 might make a difference to your study. I'm going to show you lots of little tips and tricks for efficiency, effectiveness, comprehensiveness, and you will feel confident. So there's an evaluation that we set up if anybody wants to evaluate the session. And a reminder that next week I'll be teaching part number 4 on efficient database searching. So upping your game even a little bit more. It'll be a little bit of review of OVID Medline, and then we'll look at doing some more sophisticated searches, documenting those searches, and translating those searches to other databases such as Embase. So thank you.